Welcome back to your Feel Good Breakfast Show on this Tuesday morning. And on a Tuesday, you know that we touch on all things to do with health. And as we near the end of Cervical Health Awareness Month this January, it's crucial to keep the conversation going about a disease that impacts thousands of women annually. Now, in South Africa alone, around 10,702 women are diagnosed with cervical cancer each year, making it the second most common cancer among women in the country. Now, to unpack all of this and joining us on the couch today is Dr. Celeste van Drunik, a specialist gynecologist and gynecologic oncologist, to share insights on the importance of HPV and the vaccine, regular screenings, and the latest advancements in treatment. Doc, welcome back.
Thank you so much.
Happy New Year.
To you too.
Happy
Thanks.
2025. Yes. And we want it to be a 2020 thrive, especially when it comes to our health, right?
Definitely.
But let's start with the numbers that are happening when it comes to cervical cancer and HPV around the world, and also how it is looking in South Africa, how it's impacting South Africa. Where are we right now?
It actually is profoundly impacting South African women. And unfortunately, we see, in certain areas in South Africa, cervical cancer is on the rise, and deaths due to cervical cancer is on the rise. In the rest of the world, where they actually vaccinate against HPV, now HPV is human papilloma virus, the virus that causes, in most cases, cervical cancer, we see that they eradicate HPV and that they're also actually almost eliminating cervical cancer.
Wow. Okay, well, let's talk about maybe the solutions. You spoke about HPV. What is the vaccine about, and how do you go about doing it, getting it?
I think, it's very important that all girls, especially girls from the age of 9 to 14, get it. It's part of the South African National Vaccination Program, but these are only in public schools. It's also important for girls that are older to get it. Even in your 20s and your 30s, you can get it. And we're now also advocating that if it's affordable for you, that boys and young men get the vaccine as well.
Oh, wow.
Yes.
Okay, so quick question on that. Do you get it once off throughout your life, or do you continually get it as you age?
No, it depends on your age, but the younger you are, the less doses you need. Usually 2 to 3 doses is the standard, and then you're vaccinated and you don't have to get vaccinated again, depending on your age.
Of course.
Yes.
Okay, Doc, let's talk about how many people are actually tapping into getting this vaccine in South Africa. I mean, is it common? Is it something that still needs to be pushed?
It's definitely something that needs to be pushed. More and more people could get vaccinated against HPV. It will help with herd immunity, so we can completely eradicate HPV transmission, because it's a very common sexually transmitted infection, unfortunately.
And this is why you're saying the men can also get the vaccine,
yes,
right?
and anyone actually.
Yeah, I love that. Okay, well, when it comes to cervical cancer, I'm really curious about being screened for it. I mean, I don't think this is the usual conversation you have over dinner. So how exactly does one go about this? And also, why do we need to be screened, especially maybe even women living with HIV? Why is it so important?
So it's important to be screened for HPV, which then causes cervical cancer, or for pre-cancers on the cervix, because we want to prevent the cancer before it happens. We can do certain treatments to try and prevent cervical cancer before you actually get the symptoms. So from the age of 25, definitely, and some say 30, depending if you're living with HIV or not, you should get screened, and it should happen regularly. It's not something that, it's ideal to get screened once in your lifetime, but ideally, if you're living with HIV, every 3 to 5 years, and if not, then, at least 5 to 10 yearly.
So you're saying if you are living with HIV, your risks are higher?
Definitely, yes.
Right?
Unfortunately, we see that the risk for cervical cancer, pre-cancers, abnormalities, just having the infection and keeping it on the cervix is much higher in somebody living with HIV than without.
Okay, so somebody's sitting at home right now looking at their body thinking, what are the symptoms? I know we shouldn't self-diagnose, but what are the signs that I can look out for to perhaps go and book a doctor's appointment?
Yes, so once again, you shouldn't wait for symptoms. Please go and screen before you have any symptoms. But if you do experience symptoms, they could be something like bleeding in between your cycle when it's not supposed to be your time for your period. Bleeding after intercourse is a very ominous sign, usually definitely needs to be checked out. A discharge that's not going away with some antibiotic treatment is something that needs further investigation. Only later on we get signs like loss of weight and severe pain, but that's very late. You shouldn't wait for those symptoms.
Yeah, and I love what you said before, that prevention is better than cure. So don't even wait for any of these symptoms to happen. We're going to get into this conversation for a two-parter in just a bit, but that was a nice little tidbit, and thank you so much for that information, Doc. We'll see you in a bit.
It's my feel-good breakfast show.
Welcome back. As we continue our conversation on cervical health, it is essential to understand that these powerful tools are available to women for prevention. All right, they are vaccinations, regular screenings, and of course informed choices. And these are key to reducing the risks associated with cervical cancer. And to unpack this a little bit more, Dr. Celeste is still in the building, specialist gynecologist and gynecologic oncologist, here to share some of those valuable insights. Thank you so much, Doc, for sticking around, because I do want to know a little bit more about, okay, so HPV is one of the main causes of cervical cancer, not the only cause.
Yeah, no, certain risk factors can increase your risks, but usually that is the cause of cervical cancer, yes.
Okay, and then you said prevention is better than cure. So when looking at screenings, vaccines, also preventative measures on our part, how do these even help?
So if you prevent the HPV virus from staying on the cervix with vaccination, where you help your body to clear the virus from your cervix and other areas, you can actually prevent the abnormality and the cancer eventually that then develops over years.
And that's what we definitely don't want. I mean, cancer doesn't know a gender, an age, a race. It really can affect everybody, and very harshly so. So when it comes to HPV, I mean, what do you want people to know about this? It's a word that gets thrown around, but what's so important that we need to actually write home?
I think it's important to realize that HPV, you don't necessarily have any symptoms when you have HPV. A lot of people get HPV when they're sexually active.
Sure.
The vaccine, however, the HPV vaccine is completely safe, and that's very important to remember. It does not cause any autoimmune diseases or infertility or anything like that, the misconceptions that are out there. It's actually completely safe, and it does prevent cervical cancer.
Yeah, which is the most important thing.
Yes.
I love that you touched on taboos as well, and also those myths, because I think we're quite a cautious nation.
Yes.
If we see something like get a vaccine, we're like, let me take a pause on that. So what is South Africa's approach when it comes to the vaccine? I mean, how does the rollout work? Is education being guided across the nation?
It's important in our country, and there's lots of advocacy around eliminating cervical cancer with HPV vaccination and screening, and we're doing well, but we can always do better. The WHO has a target for us to vaccinate 90% of eligible girls, which we're not there yet, so we can definitely push for vaccination. Screen 70% of eligible women, which is very important, as we've discussed, to prevent cervical cancer before it occurs. And then the last is a 70% to get actually treated and followed up and managed if you have a positive screening test picked up.
I love that you're also providing a bit of hope. You're saying it's not the end.
No.
There definitely are ways that you can either prevent or just help yourself manage your current state if this is what you are dealing with. But if women are fearful right now, because like I said, we are a cautious nation, to even book that appointment, to even go for the screening or find out how they can go about doing this, I mean, what encouragement would you give them?
I would say that don't be scared. It's better to know than not to know. I think you must also remember that it's not a painful test. It's not great. It's sometimes a little bit uncomfortable, but it's very quick. And the great thing now is that we have self-sampling. So you can ask your healthcare worker about HPV self-sampling, where you can test at home yourself and send the specimen in to your healthcare provider or the lab, and they can test, and you can be screened in that way if you really want to avoid a pap smear in that way.
Yeah, because pap smears feel invasive sometimes, you know? I mean, it's such a vulnerable position you're in, and then also it feels very much like you're involved here. I did want to find out, when you say healthcare professional, just doctors, or are we also talking about your local clinics?
No, I think anyone, if you just start the conversation, anyone that's in the healthcare industry that is qualified, even if it's a nurse, a sister, a pharmacy, you want to ask about the vaccination, it's a good idea to start the conversation and to get that going and to just inquire and get more information as much as you can.
Absolutely. Doc, thank you so much. We need to have more of this conversation, not just in January, where of course we're raising awareness around it, but we, I think, can all be advocates for our own body and for our fellow women that also may experience this in their future. So thank you so much for sharing that good news.
Thanks for having me.
Oh, of course, and we can't wait to have you back. Now, as we've learned and said it time and time again, early detection and of course prevention are definitely our strongest allies in this fight. So let's just continue to advocate for awareness awareness for ourselves, for a vaccination, and also for screening, even after this month does end. And January ends this Friday, so make sure that for the rest of the year that you definitely are taking care of yourself. For now, though, moving from all things to do with health to fashion, we got to find out from Zanele, what are the people saying about Raoul's outfit?